Well, moving on, we have another exciting session. Again, something we've never done here at the Autoimmune Hepatitis Association patient meeting, a little bit of a dive into acupuncture. And so I'm really excited to introduce Ying Wang. She's an MD, Ph.D. here at IU. She's an assistant professor of medicine. She studies the efficacy of acupuncture on pain management, specifically in patients with sickle cell disease, I think fibromyalgia, and also cancer as well, if I'm correct. And she's even interested in how this maybe impacts the immune system. So we thought that this would be a great place for her to come, tell us a little bit about her research, and maybe show us and learn us about how acupuncture works if you've never been exposed to it, but also maybe theoretically how this even works to control different symptoms with AIH. So join me in welcoming Dr. Wang. I appreciate it.
Hello. Thank you, Dr. Lammert. I'm basically here to explore some potential collaborations with Dr. Lammert in alternative medicine in treating autoimmune disease. There hasn't been explored. This area has been largely unexplored, so we hope that we can have some discussion with all of you and other investigators and scientists to explore some potentials by using alternative medicine like acupuncture in future clinical management. First, start with the overview of my research background. I've been, in the past 1 decade, most of my research is focused on studying acupuncture analgesia in different pain models, including the neuropathic pain, inflammatory pain, cancer pain, and right now I'm more focused on the translational and clinical research in sickle cell disease associated chronic pain and acute pain crisis. What's the principles of acupuncture treatment? This might be the first question most people ask. And does acupuncture hurt? That's a question most of my patients ask. So I will start with here. There's 360 acupoints as main points located in 12 main meridians. Acupuncture is a stimulation of specific acupoints along the skin of the body using the thin needles. There's many types of acupuncture. The frequently used are manual and electrical acupuncture. And based on traditional Chinese medicine series, the principles of treatment by using acupuncture is to activate the qi circulating the meridians. The qi is considered as a vital substances constituting the human body. There's many studies about the physiological functions of qi, what is qi inside the body. Something I will talk about in my later slides. The main difference between Western medicine and Oriental medicine would be the fundamental understanding about the human body. The Western medicine has divided pain into different categories based on the physiological basis or pathological basis of pain, such as nociceptive pain, neuropathic pain, inflammatory pain. The number one treatment for pain, especially for chronic pain and severe acute pain, is opioids, which is painkiller, we know, and some other OTC drugs. Well, compared to Western medicine, traditional Chinese medicine, we consider the pain as a deficiency of a healthy qi or a blockage of the qi. So the treatment principle will be quite different by using different strategies, including acupuncture, herbal medicine, or other alternative medicines. We think there's 6 external factors invading the human bodies, including the wind, cold, heat, dampness, And there are 7 internal impairments, including joy, anger, anxiety, contemplation. The treatment principle in overall is to dispel the blocked unhealthy qi in the meridians. And many people ask, am I going to be hurt by using acupuncture needles? The answer is no. The average diameter of acupuncture needle is 0.25 millimeter, and there's many thinner needles than that. Sometimes you barely feel there's needle penetrate your skin. There are many frequently used acupuncture-related techniques, including the manual acupuncture, electroacupuncture, TENS on the acupoint stimulation, eye acupuncture, scalp acupuncture, and auricular acupuncture. What do we know about acupuncture pain research? I think this is the data from back 2020, the pain-related conditions listed by the WHO that can be effectively treated by acupuncture through the controlled trials. There's still lack of studies, including both preclinical and clinical studies, in understanding acupuncture analgesia in many pain conditions, including the autoimmune system diseases. Our understanding about acupuncture analgesia originated from the 1970s. Yeah. It started from Dr. Han, and they found that the different frequency of electroacupuncture could trigger different neuropeptides and endomorphins, dynorphins, enkephalins, and beta-endorphins, which bind to their opioid receptors and then triggered anti-nociceptive effect and other effects such as anti-inflammatory effects. And there's many studies after that in many other different pain conditions in both clinical and preclinical studies, has revealed that more inflammatory biomarkers has been involved in manual acupuncture or electroacupuncture triggered analgesic effect in chronic pain models. And some of them are upregulated and some of them are downregulated in response to acupuncture treatment. Oh, I think I have. Another clinical study about electroacupuncture by Texas University, I believe. And they had a clinical trial back to probably a few years ago. They used electroacupuncture in combined with opioid, which is morphine, in 100 women undergo major gynecological procedures with the standard general anesthetic techniques. And they found a combined treatment with electroacupuncture with morphine could reduce the post-surgical morphine dosage. And there are many other studies after that, but I just want to give you an example. This is how acupuncture has been used in surgical area and analgesic studies. So why do we need integrative and complementary medicine in clinic? The data has been changed slightly here. In my next slide, there's more than 68,000 people died from overdosing on opioids for pain control. And 130 people died every day from opioid-related drug overdoses. And more than 11 million people has misused prescription opioids. And 2 million people had opioid use disorder. The study on alternative medicine has been extremely limited. It's just more emerging studies in recent years. But studies in acupuncture analgesia still have some issues because lack of placebo control, the small sample size, and the compelled evidence, which prevent its large application of acupuncture in clinical management. So, yeah, this is the new data I want to show you, that by the end of 2020, there's more than 68,000 people has been died because of overdose on opioids. This is the data from, forgot the name. Yeah, so we all know there are side effects of long-term use of painkillers, including such as morphine, oxycodone, hydrocodone, have been frequently used in many pain conditions. In my study in sickle cell disease, these are frequently used drugs. And we all know that they have the side effects from long-term use of opioids, such as sedition, dizziness, nausea, vomiting, and other tolerance addiction side effects. With a limited population of alternative medicine users in U.S., majority of the individuals, more than 63 individuals use biological products. Those include herbal medicine, diet, and supplements. There's only less than 12% people use mind-body interventions. The definition for mind-body interventions, including both spiritual and manipulative body-based methods. And acupuncture belongs to the second one. There are still very limited strategies by using mind-body interventions in clinical pain management. So we think that this is the dream modality in clinical pain management, including conventional care, such as the painkillers and precision medicine, holistic medicine, complementary medicine, and also patient themselves, the lifestyle and self-care is extremely important to trigger optimal effect. Many patients ask about, will acupuncture help with my pain? The answer is different based on the pain conditions. I have done a lot of studies in preclinical studies in animal models with different pain conditions. I just here use a model with sickle cell pain as example. What we found is that with continuous treatment of acupuncture, the mouse model with sickle pain presented with varied responses to the treatment. And there are 60%, 6% mice has presented as high responders. They have a more than 100% pain threshold increase. Increased pain threshold indicate decreased pain. And there's a 20 to 30% present as mild responders. And there are also 10 to 20% non-responders. The scientific reason underlying the varied responses to acupuncture, including both genetic factors and also some disease pathological related factors. So it's really hard to say how your body will be respond to the treatment. It also depends on the practitioners, because this is experience-based treatment. In our study, ongoing trial in patients with sickle cell disease, we have observed more than 60% high responders, and relative to similar 10% or 20%, 15% of non-responders. So it's really disease-based responses. So last session, I want to talk about the ongoing clinical trial we have now, supported by National Institute of Health and Indiana University of School of Medicine, about acupuncture treatment in patients with sickle cell disease. If you have any friends or relatives or whoever you know has sickle cell, welcome to refer to our study. This is a randomized controlled clinical trial with acupuncture treatment. I think there's some issues here in the wording. But we'll start with a pre-screening, a very brief pre-screening script And then before we start with the first treatment, we'll have some pre-treatment sessions, including the MRI and the physical assessment. Basically, a general assessment for your physical condition, whether you'll be eligible for the study, and before we do the randomization. And then following the 5 weeks of treatment, we now also offer a 3 months extended treatment because of outstanding effect and requested by many patients. We also offer extended treatment sessions. And then following the treatment sessions, we'll have the post-treatment sessions that will be identical with what we've done before the treatment starts. And then we'll have a 6 to 12 months follow-up visits, which can be done either remotely or in person. The features of this trial is it's the first and largest randomized clinical trial in the nation, studying acupuncture implemented integrative care in patients with sickle cell disease. And this is also the first clinical acupuncture trial using comprehensive traditional Chinese medicine diagnosis scheme. By using the TCM diagnosis, we're able to categorize your TCM features and customize a treatment based on your condition. And so far, we have 63 individuals with sickle cell has been enrolled in the study within 24 months. And the retention rate is above 80% before the first treatment start. And following the first treatment start, we'll have more than 90% retention rate. The patient-reported clinical outcomes, including pain and the quality of life outcomes, has been great so far. And this is a general introduction of my team in IOSM and my collaborators of scientists and physicians. So we do have a demo today. If any of the attendees interested in have experienced acupuncture, we can have a live demo on you. Otherwise, I also have my mock subjects. Any questions so far?
I'm just curious to know, is this expensive or is this covered by insurance or?
So this is much more of like a clinical trial. So we are not accepting any insurance or any other thing. So it is free. Yes, exactly. Oh. Yeah, so it's for sickle cell patients, but we are also looking for healthy people too as well to serve as a control group for the trial.
So I have a question for you. Oh. Okay, I do have an acupuncturist, and she's also MD, internal medicine doctor, and she believes this helps actually inflammation, lowering your body inflammation. So I just want to know if there's any findings or if any like personal opinion about how it helps with your inflammation.
Yeah, Dr. Wang, we're talking to you. Can you hear that? So the question is about the implications of how this affects inflammation in general.
Can you repeat that question again?
So the question is, does acupuncture, again, modulate or modify inflammation? And is there anything you can speak to that?
Yes. The inflammatory biomarker is one of the key clinical outcomes in building this study. We're studying both brain biomarkers and the peripheral circulating biomarkers. There has been found that there's many anti-inflammatory, there are a series of anti-inflammatory cytokines and chemokines has been reduced following the treatment. Because the study is still ongoing and it's unblinded. So there's control treatment and the real treatment, so we don't know we trigger that effect. However, we do see a combined treatment reduce some of the pro-inflammatory cytokines and increased some of the anti-inflammatory cytokines. We also have observed some alterations of the brain biomarkers by using the MRI, because MRI and the EEG is also part of the study sessions. We see a change of the brain signals before and after treatment.
So do
Yeah.
you think, would it be better to have people come up to see it in person
Yes,
closer?
yes.
So if you interested to come and see Caitlin undergo acupuncture? It may, I feel like I have to tell everybody what's going on. I don't know. I can't do the play-by-play. Does anybody want to come see? Come on up. So Dr. Wang, can you explain what you're doing?
You're gonna do that.
Oh, okay. I'll repeat what she says.
She's gonna cleanse the area.
Okay, so she's cleansing the area. She's using an alcohol wipe.
And then we'll insert needles on the suspected area.
So she is now inserting a needle.
I'm kidding.
All right. So that's the acupoint called Ying Wang. It's acupoint on the heart meridians, help with release anxiety and some heart-related issues. So that's a frequently used acupoint. I would rather not touch it. Yeah. And in this study, we actually customized a series of treatment with different acupoints for different individuals. It has to be individualized treatment. This is a feature of this trial compared with other trials. We have a standardized treatment, but we also have a customized points and manipulations on top of the standard treatment protocol.
So taking it back then, how long would you leave these needles in a patient?
In average, 30 minutes. Some patients are highly sensitive to acupuncture treatment. We sometimes can shorten the time to 20 minutes to 25 minutes. And some patients are just slow responders, or sometimes increase the time to up to 35 or 40 minutes. Yeah.
What points would you target for autoimmune or liver function?
So still, the acupoint selection and the manipulation will be based on the individuals. We normally choose a standard series of acupoints that will help to boost immune system, like ST36. But we also, on top of that, standard acupoints will also customize a series of points based on each individual.
So Caitlin does acupuncture too. So what is the approach that you take?
Oh, well, I was gonna ask, do you do the thing where you hold the person's hand and feel for the pulse and because that's what my acupuncturist does. He like sees how my blood's flowing that day, and then he decides.
So this is a part of the diagnosis procedures before the treatment we normally do. It's part of the traditional Chinese medicine diagnosis. We do pulsing, we do observation. We also do some inquiries, like collecting the comprehensive medical history. This is called a TCM diagnosis. That need to be done before the first treatment starts. So maybe every practitioner has their own strategies, like holding the hands or feeling the qi or meridians, but this is not a standardized TCM procedure.
Go ahead, Jean.
So there are different types of acupuncture, right? And I believe you do Chinese traditional one. Is that what your method is, the Chinese style? So do you know anything difference between Japanese dry needling, or they all have the same benefits?
So, yeah, there's different type of acupuncture, many different types. Especially in Asian countries, we have all different modalities of acupuncture techniques. In this study, initially we're thinking about the use of electroacupuncture, because electroacupuncture has been in many publications studied, has in-depth study. And we, after a few pilot studies at the beginning, when we established the study protocol, we observed a robust effect by using the manual acupuncture only, without any stimulations. That's why we stay with the manual acupuncture protocol. And yeah, I know dry needling too. Yeah, yeah. In sickle patients, they're a very vulnerable population. Many sickle patients, they are high responders to acupuncture, very sensitive, and they can develop a painful crisis anytime. It's unpredictable. So for sensitive patients, we want to start with a conservative approach, like manual acupuncture. We also need to adopt very mild stimulations with manual manipulations, different techniques, based on each individual.
Great. So in the observance of time, maybe we can move on, but can we thank Dr. Wang and her team for coming and show us what acupuncture looks like?